I get asked this a lot. Why now? Why in this moment? China's trying to do this, and sort of why so quickly? One of the things is you can't really do a partial zero COVID strategy. When the virus spreads, it spreads. It's not something that you can do. That's not we know how Omicron travels. Secondly, is that in the last 3 years, China has also been preparing itself, most importantly around infrastructure, the medical infrastructure, to be able to withstand or be able to better confront a virus of this nature.
Right.
The people are more protected, such as with vaccinations, and obviously taking advantage of the immunity of the newly vaccinated people. Was chosen as the time, despite it being winter, which means there's more other related sort of winter illnesses that make it complicated. But this was judged as a good time to have this opening.
Hello, everyone. I'm Rania Khalek, and this is Dispatches. According to Western media, China can't do anything right. They screwed up COVID at the very beginning by doing too little. Then they quarantined entire cities, and that was far too much. Sure, it was an unknown deadly virus that was killing lots of people, but freedom or something. Then they did zero COVID, which was portrayed as authoritarianism. Unlike in the free West, where masks in crowded places were quickly ditched, PCR tests took days, sometimes weeks, and cost $100 or more, and millions of people needlessly died. That's real freedom, apparently. Now that China's getting rid of some restrictions, it's reckless, maybe even murderous, and proves that China had it all wrong. Because again, China can't do anything right. Or, if you look at things objectively and take off those Western-colored glasses, it's possible China did a lot right. China used the last 3 years to try to prepare itself the best it could by vaccinating people, studying the virus, building medical infrastructure, training workers, and waiting until a much less deadly strain emerged. It also gained hard-earned experience that's essential to managing any future pandemic. To understand what's really going on and how China's policies towards COVID have succeeded and evolved in an attempt to protect a country of 1.4 billion people during a deadly pandemic, I'm joined by Tings Chak, a researcher at the Tricontinental Institute and a member of the Dongsheng News Collective, who's lived in China throughout the ebbs and flows of the COVID-19 virus. But before we jump into it, be sure to hit the subscribe button and the bell so you get a notification whenever we post new content. And if you appreciate this show, you can help it grow by becoming a patron at patreon.com/breakthroughnews or by donating below on YouTube. Tings, welcome back to the show.
Thanks, Rania.
It's so good to have you back on for 2023. Actually, this might even be the first episode I've recorded in 2023. So that's very exciting. And obviously, this is a very important topic that we're going to be discussing. You wrote this excellent piece for Monthly Review, which I will link to in the description, all about the evolution and success, actually, of China's COVID policies for the last 3 years. But of course, in the US, across the West, from the beginning of this pandemic, Western media has criticized China, like no matter what it's done, right? First, it was that China didn't do enough, and China was even held responsible for the emergence of the virus. Then China was doing way too much by quarantining cities and then doing zero COVID. Really every mitigation measure that China put into place was framed as authoritarian. And then now that China's starting to relax some measures, Western media is kind of almost boasting that it's going to kill people in a really gross way, like either China's being reckless or China waited too long. And I want to show a couple examples of this because it's really gross. I mean, here's a pretty extreme example. This is Fox News. I don't know how, I don't know how accurate this is. It seems a little far-fetched, but of course the headline for those who are just listening says, China COVID crisis, Beijing hospital runs out of beds, families burn bodies in streets as death spikes. I don't think there is actually any evidence that people are burning bodies in streets, but that's a pretty extreme example right there. Then you actually have this more sort of calmer version of boasting, which is mainstream media outlets like this is the Washington Post I'm showing, saying that new models predict at least 1 million deaths in China amid COVID surge as a result of relaxing measures and all of China's missteps. And so I just show these as examples before we get into what's actually transpired over the past 3 years here. And in your piece, you actually write that, or you categorize China's strategy as being four phases. And before we go into like the specific details of each phase, I'm wondering if we can actually start out by you laying out the general idea and timeline for these four phases.
Yeah, absolutely. I mean, just seeing these headlines was part of the reason of kind of inspiring me to, put an article together. Because at some point I woke up and saw the Western media and saw, are they caring about Chinese lives now? It seemed like they didn't care about it so much when Wuhan broke out. So all this sort of draconian, dystopian, or the nightmare now, it seems like no matter what China does, it's terrible. But I think this helped actually push me to think about the phasing because I actually lived through the COVID era of the last 3 years and seeing how much it has actually changed along the process. So I would say quickly, the first phase is really the emergency response. Remembering back at the end of 2019 when the virus broke out in Wuhan, it was completely unknown. There were no vaccines or other protections. So the city was shut down. Medical workers were dispatched from across the country, and the virus was studied. And the priority of this initial phase of a few months was to save lives, and that's what happened in the Wuhan phase. Um, and the second phase would be pretty much, shortly after. Remember, Wuhan was locked down for 3 months. Was the control and elimination phase. So this is actually how to deal with this COVID reality and protect lives. And this is when the zero COVID idea came about. And I would say this was a very successful period because for over a year, almost no new deaths happened in the country. And this would be when a huge amount of the deaths happened around the world. And despite even, China being able to contain 11 different Delta outbreaks, which was, of course, a very deadly variant. So the third phase would be basically the year in the lead up to just this past October, where we started introducing, or the government introduced, what's called the dynamic COVID zero. Of course, the virus doesn't stay stagnant. It's something that changes, new variants, they become more transmissible. We know more about the virus. And also, we have to balance the economic impacts and the impacts on people's lives. So there's a testing period of basically shifting from these sort of mass lockdown strategies to looking at how to do mass testing or more localized targeted measures, locking down neighborhoods or communities, etc. And now we're into the fourth phase, which is really the phase of Omicron, and understanding that the transmissibility and the deaths are much lower, and it's a downgrading of the severity of it and easing controls. And we're right now in this phase, and it's a transition for a country of this size and this population.
Right. And then you say in your piece, which I think is really important framing here, you say that it's not an end of an era, but rather it's a continuation of a rigorous process of confronting a historic and global pandemic while putting science and the people at its center. So I'm wondering if you can explain how this is a continuation and why relaxation measures are happening now.
Absolutely. I mean, I think it's important to emphasize that China is quite a scientific country, and people here believe in science. And it seems strange, but in 2023 now, it seems to be important to repeat that science is actually important. So as I said, zero COVID wasn't a static thing, and it wasn't an end on its to its. It wasn't an end, but a means to control a virus that we didn't know much about. Um, and so right now, what has happened is that there's a lot more studies that have been done about what Omicron is and the dominant variant that is around the world and specifically here in China. It's more transmissible and has much lower virus load. So this means that it's actually 100 times less of the virus load than the original variant that we found in Wuhan. And so with this, there was already a process that began in November, actually, on November 11th, where the country began easing measures. And it was a set of initial 20 measures that included reducing, mandatory quarantine time for travelers coming from abroad. Now, as of 2 days ago, that's been completely removed. uh, increasing vaccination of the elderly, which is still seen as a vulnerable population, and the elimination of use like mass testing. And linked to this, there was a further kind of set of easing, which is a classification of the virus. So in China, there's a three-level classification of infectious diseases. The first is Class A, the most infectious, which is like cholera and the plague. Those are the only two actually on the list. And COVID was formally, as of 2 days ago, dropped from Class A to Class B, which is in line with other diseases like SARS or AIDS or tuberculosis, but still above the third class, which is flu, mumps, and much less dangerous diseases and infections. So I think one of the things is important to say is that it's not about having no plan, which I think a lot of the Western media started attacking China for, or that it's kind of one fell swoop removal of all measures. But it's a process that's changing according to the science and the knowledge of this virus. So, for example, changing this classification is quite significant. It means that all the policies have to also change accordingly to how China deals with infectious diseases. And with that, there's a variety of other countermeasures that were put in place in this transitional moment. And maybe I just want to add one thing because I get asked this a lot. Why now? Why in this moment China's trying to do this, and sort of why so quickly? One of the things is you can't really do a partial zero COVID strategy. When the virus spreads, it spreads. It's not something that you can do. That's not we know how Omicron travels. Secondly, is that in the last 3 years, China has also been preparing itself, most importantly around infrastructure, the medical infrastructure, to be able to withstand or be able to better confront a virus of this nature.
Right.
The people are more protected, such as with vaccinations. And obviously taking advantage of the immunity of the newly vaccinated people. Was chosen as the time, despite it being winter, which means there's more other related sort of winter illnesses that make it complicated. But this was judged as a good time to have this opening.
Yeah, it's a really, really good point. And I think also speaks to, and we can come back to this, but there's actually a lot to learn from the many different ways China handled this. But I want to talk a bit about zero COVID because nothing is really, at least from what I've consumed in terms of media, nothing has been bashed in the West more than zero COVID, which has really been characterized as some sort of like dystopian, nightmarish, permanent lockdown that absolutely failed and led to people just being in their houses all the time with nothing to do and nothing going on. And you actually write, far from failing, as the Western media is claiming now, zero COVID worked extremely effectively. So, can you maybe elaborate on what exactly was zero COVID as a concept? And you've been in China for most of this time. So what has it been like living in China during that zero COVID policy?
Yeah, I mean, I think I just wanted to kind of go back 3 years ago because, when I arrived, I'm originally from Hong Kong, but I've never lived in mainland China, and I moved back here and 3 years ago, and that was in March of 2020. Just to get a sense that it was just a week after I arrived to the day that China started its travel ban, that what was a defensive measure against virus. So it was a very early period. At the time, Wuhan was still in lockdown and would be still in lockdown for a few more weeks. And now, just now, 2 days ago, did China lift that travel ban that was implemented a week after I arrived. And in that time, I also lived in Shanghai throughout the 2 months of the recent outbreak back in May and June of this year. I've also lived in Beijing now, where I'm based, and seen the sort of mass testing and the different changing eras of the virus and the virus response. So in that sense, I think one of the things that I have learned in trying to summarize and, writing this article, which is quite long, but I think it has a lot of the details that Western media has just failed to provide. One of the things that really impacted me is to see that I think, the Chinese government acted with what it could, with what it knew, and with what it had available in terms of the medical infrastructure that was available, the vaccines that were available, and the silent science that was available. And at the bottom of it, lives really mattered. Human life mattered. And at times, was it difficult? Was it inconvenient? Did we, many of us miss our families, especially those who, have families in different places? Was there a sort of collective cost to make sure that the most vulnerable, especially the elderly or those with other complications, were protected? Absolutely. But there is nothing that would convince me to say that this COVID zero policy or zero COVID policy was a failure. I mean, what happened in the world in the last 3 years? We have, approaching recorded deaths, almost 7 million people who have died. We've had over 650 million people infected. In China, those numbers have remained relatively low for a country of this size. And in a way, this zero COVID was never the kind of end goal. It was actually how to live with a deadly virus, or how to be able to manage a deadly virus such as this, while balancing the social, economic needs of the people and the country and the world. So that's partly why I decided to write this article.
And I mean, that's a really important point you raise. I mean, 7 million deaths worldwide, very few of them were in China, especially like if you compare it to the actual size of the population. And during that zero COVID implementation, while China was preventing the spread, the rest of the world recorded, and this is in your article, the rest of the world recorded over 5.4 million deaths by the end of 2021. Whereas China had thousands, right? And most of those had actually been in the beginning. So can you maybe give us an idea, like, let's say China had decided to implement the same policies or lack thereof as the US and Europe did? What would have happened in a country like China, where we're talking about 1.4 billion people? What might have been the outcome had they done what the free West had done?
Yeah, I mean, it's I was thinking about sort of in this article just to compare it, because there's been a lot of quite exaggerated numbers without a lot of scientific basis around what will happen to China now or what would have happened in China. But let's just use the US China comparison, sort of brute numbers. So the US has recorded 1.1 million deaths due to COVID
Mhm.
since the pandemic broke out, which is about 800 times that of the death rate of China. And so if China were to follow this, the policies of the US, or as you said, the lack thereof, just by brute numbers, it would be about 4.8 million people dead. So even a quick calculation shows that, the zero COVID policy of the last 3 years indeed saved millions of lives. That's just a fact.
Mhm.
But I think I also want to mention that I think China showed a lot of leadership in the international scale around this question. Wasn't just interested in protecting its own people. Remembering when a lot of the global North countries were hoarding vaccines, or the big pharma was busy profiteering off of vaccines, China was making some important commitments to the world, particularly the developing world, the global South countries, providing and donating vaccines. And actually, according to a Nature study, the scientific journal, China has provided up to half of the world's 7.3 billion doses that have been delivered globally. So that's a kind of, in terms of the amount of lives that have been saved, not only within China, but in the world, is something that, we can't actually put a number to, but it's in the many, many millions.
And I think one of the really important numbers to focus on here too, that really shows the outcome or the variation in outcomes of these two policies, is the issue of life expectancy. And you note in your piece that the average life expectancy of Chinese people actually increased, surpassing the US for the first time in history. While in the US, the average lifespan dropped because of the high number of COVID related deaths. And you even have a pretty uh, shocking chart to show here. Again, I really do encourage people to check out this piece. There are quite a few interesting charts, lots of numbers, pieces of information. But I want to show this chart on the screen, which is basically shows the change in life expectancy in China versus the US from 2019 to 2021. And you can see like they basically were like switched places. Um, and this comes after China had already raised its life expectancy following the success of its program to eliminate extreme poverty, which you covered in detail last year for a Tricontinental report that people can go watch an interview with you about on Dispatches from last year. Or actually, I think from almost 2 years ago, but just throwing that out there, I can maybe include a link to that as well. But to the issue of life expectancy, I mean, can you talk about the change in life expectancy, particularly in China? And I mean, you can even go back to the issue of eliminating extreme poverty and then the COVID response maybe even being a part of that in a way. Um, but also, more importantly, I mean, the significance of a country like China, which is still technically like a developing country, surpassing life expectancy in a very wealthy country. I mean, if not the wealthiest country in the world, the United States.
Yeah, absolutely. I mean, I think the look at life expectancy is a really important one, and I was able to learn from different economists with a particular like a socialist outlook in doing that study on the poverty initiative in China to understand how important life expectancy as a metrics because of what it can capture as a number. It captures questions of not only an economic standing, right? It looks at questions of social access to education, to healthcare, questions about gender, or the environmental factors that affect health. So, in a way, life expectancy is kind of the best sort of quantitative measure of human rights. You know, a lot of human rights warriors around the world like to, I think, criticize China on a variety of fronts, but look at life expectancy. So what was so interesting is that in the period of COVID in the last 3 years, not only did China's life expectancy grow by almost a year, but actually surpassed the U.S. as you mentioned for the first time in history, and U.S. actually dropped over a year, nearly 2 years during that same period. That's between 2019 and 2021 is the numbers that I had. And this was in large part due to the huge numbers of deaths related to COVID in the US, which China did not experience. And in fact, the US experienced one of the largest drops in the average life expectancy in recent history. I've heard, comparisons to, World War I or even earlier to the earlier 20th century. So this is huge. I think it's also more important to look at this in a longer context too. As you mentioned, China is still a developing country, and when the PRC was founded in 1949, it was actually the 11th poorest country in the world, with an average life expectancy of only 36 years. In the US, it had already arrived at 68 years old. So
Mm-hmm.
when you look at the last 80 years nearly, the average Chinese person's lifespan has more than doubled. Whereas in the US, it's only grown by a mere 8 years in almost 8 decades. So I think this helps us put into perspective about the vast increase in the economic, social, and variety of factors of an average person here. And we always like to say, the average Chinese person is living their best 40 years in the last 4,000 years. It's hard to convince an average Chinese person that they are living in this sort of draconian, oppressive, backward society that the West likes to claim.
Yeah, that's a good point. Um, and then I want to go to the issue of vaccines too, because this actually didn't receive much attention. I knew China had vaccines. I actually didn't realize how many it had developed until I read your piece. China actually developed quite a few of its own vaccines. We only really heard about one in the U.S. And I don't even think the U.S. recognizes it as a legitimate vaccine. Obviously, there's no more vaccine mandates in the U.S., but when there was at one point in certain settings, I don't even think that the Chinese vaccine was recognized as one that you could show the vaccine and it would be like accepted as legitimate. But nevertheless, China did develop its own vaccines. And then, unlike the pharmaceutical greed in the global north, and I think you alluded to this, China actually shared much of its vaccines with poor countries in the global south. Can you talk about China's vaccination program? And was also, I mean, just to add on to that, was there any sort of anti vaccination movement in China like what we saw in the West as well?
Sure. I think about the vaccination question, especially of the kind of global impacts. Um, China did develop its first vaccine, Sinopharm, by December 2020, which was accepted by the WHO for emergency use by May of 2021, so a few months later. And since then, China has a total of 8 approved vaccines, and there's 35 others that are undergoing clinical trials. So that's been an ongoing process to respond and to develop more effective vaccines, including now there's actually an approved inhaled vaccine that is being prioritized for elders because it's easier to implement. But in addition to this is this commitment to the rest of the world that doesn't have the productive capacity to develop their own vaccines. So it actually donated over 328 million doses to the world, prioritizing global south countries. Remember when there was the COVAX global vaccination program, distribution program, China was one of the big contributors, donating almost $100 million to that initiative. And also, I think one that was kind of fell to deaf ears was the proposal by Xi on an international stage to make vaccines for COVID a global public good rather than a source of profit. I think that wasn't really responded to for a variety of interests that you also mentioned, would never allow for that to happen. Of course, why would you protect public health when you can profit off of it? But on the question of the anti-vax movement, I mean, I don't think there's anything comparable to the West. But I do want to highlight that there was some sort of resistance to vaccines, because many people have asked me, what is this question about vaccination of the elderly? And I think it's a really good one. Um, and because many countries in their vaccination programs, they usually started by prioritizing the oldest to the youngest to get vaccines as they were made available. But China didn't do that. And why is that? And this is not for the lack of vaccines. There's already been 3.5 billion doses administered here, which means that over 90% of the population is fully vaccinated with at least 2 doses. But there are some sort of preconceived notions, especially amongst the elderly, about vaccines. And many, including family members, were worried about the complications that would come with getting vaccinated. That's a kind of public knowledge, as sort of public education aspect. But another thing is interesting. It actually linked to the successfulness of the COVID measures during most of the last 3 years, which really disincentivized elders to get vaccinated. COVID just wasn't around, so why should you get vaccinated? There wasn't sort of a coercive program, and you have to convince the elders, and so that's been a real focus of the last months, especially as in preparation for this relaxation period. So in the last months, we've seen that stepping up. For example, I have data from the first 2 weeks of December, and over 800,000 people who are above 80 years old were boosted. So that's been the big priority, knowing that that still is the most vulnerable group.
And then, of course, there's the phase 3 that you talk about, which is the dynamic zero COVID. That includes preparation and adaptation. And during this phase, you talk about China ramping up its capacity to test entire cities en masse and make testing affordable, which of course couldn't be more different than the situation we had in the US, where even now, I mean, a PCR test will cost you like $100 or more. It's really hard to find. Or if you get like something free from somewhere, it's going to take like a really, really long time to get back, and it's not guaranteed when you'll get it back. But this is also, of course, when there was this digital travel code that was introduced through a cell phone app, which was also framed very negatively in the US as like being very authoritarian. And then China managed to implement this system where they could really put any town or city into a temporary lockdown if need be to contain outbreaks. And in the US, again, such policies were framed as being incredibly harmful to the economy. But what's interesting here is that China's economy, as you point out, actually grew at this time. While in the global north countries, in Europe, the US, economies had actually contracted and have still struggled to recover. You actually write, I'm going to quote you here, that China's GDP grew nearly 4 times faster than the US and 5 times compared to the EU from the start of the pandemic to Q3 of 2022, which I think is a pretty amazing statistic right there. Can you elaborate on this phase and the important lessons learned from it?
Yeah, I mean, absolutely. I think, as I mentioned, one of the lessons I learned is really around what it costs to protect human life. from sort of a societal level, the collective effort that needs to be made in order to protect the most vulnerable. But of course, it comes with the economic costs. This is, PCR tests don't fall from the sky.
Right.
But earlier this year, I think the government made a really important announcement. In China, there's usually at the beginning of the year, there's a official expectation of what the GDP growth will be for the year. Um, and this year, I don't think it's a small point to say that the government decided to suspend that forecast and told the country, try your best. I think that's extremely significant because that's a message to say protecting the people, despite some of the economic pressures, and those are huge, and I'll mention a little bit about that. Uh, Try your best. That's not the focus. Economic growth is not for at all costs. And so we're expecting the numbers to come out, and probably it's going to be about 2.7% this year, which is one of the lowest growth rates in recent decades. So China's economy is going through a difficult moment, but it's certainly not collapsing. And of course, you already mentioned the data around the growth of GDP of China compared to the rest of the world, and was the first large major economy to be able to get a positive growth after the pandemic had hit the world. But I also want to use an example. Let's use the PCR testing to kind of show how Chinese government has been responding to it. I was shocked. I had a chance to leave China during this time and see what was the costs of PCR testing.
Mm-hmm.
Um, you mentioned it's just hundreds of dollars. That's something unaffordable, which essentially means that if you get sick, you can't get tested. I can't count how many PCR tests I've had to do here. And of course, the West will complain that that's draconian and that's controlling. But all of it was paid for by the government. And of course, in that kind of scale, China was able to increase its efficiency and not only decreasing the production and the testing facility, but also be able to understand how the virus works and how effective vaccinations work. And this was actually part of the scientific development. So just to give a sense, a PCR test now is equivalent of 50 cents to
Oh,
produce in China,
wow.
because of this kind of development in the science and in the production of it. Of course, we're not using mass PCR testing anymore, and everyone's excited about that because it is quite annoying to always test. But, anyways, that's not the biggest of complaints. That was something that worked for a good period of time and protected a large number of people. But the question of the economy is an important one because that became a huge expense. China spent about $45 billion in providing PCR tests
Mm.
up until the middle of 2022. And I use this number, and probably it's an understatement, but I mean, just last year alone, Biden's government contributed more than that in arms to Ukraine and so-called aid,
I
So
can't
this
even
says
keep
just a
track.
lot,
I can't even
in
keep track.
bombs or in PCR tests, have your pick. I'm going to choose my health over that. So but this is a huge cost. That's we're talking about a huge percentage of the GDP. Local governments were feeling a lot of the stress of this. And so that those economic pressures are real, but very, very far cry from the collapse that you'll be reading every other day in Financial Times or what have you.
And then, of course, in the US, the major gaps in the healthcare system became so apparent as the pandemic hit. Hospitals were strained. I mean, there was people, in the hallways. It became so clear that, like, all these beds, I mean, under neoliberalism in the US, there was this big drive to reduce the number of hospital beds to make hospitals more efficient, because you want to be at 90% capacity. I mean, really, hospitals just running like companies now, as opposed to being prepared to provide care in an emergency kind of situation. And it was really like chaos. I'm sure many people remember in those first few months how horrible it was. And of course, with every major uptick in COVID cases, it would happen again. But of course, nothing has changed in the US. Like, it's not like this happened and the US had this big sort of like epiphany of, oh my gosh, we have to restructure our hospital situation because we're not prepared. Nothing changed at all. Whereas in China, that this was used as an opportunity to fill in gaps in the healthcare system, to improve it, to build it up to be able to deal with any future crises. And China's capacity to do that in such a short amount of time was so impressive. I mean, even to the point where like Western media had to admit how impressive it was that China was like able to literally build like these huge sort of hospitals in 7 days. I don't know if that's an extreme example. Um, but can you elaborate on this point? Because I think that this is one of those like lessons learned kind of things where other countries should be looking to this to say, oh my gosh, look at what China did in expanding its healthcare capacity during this horrible crisis.
Yeah, I mean, I think we mentioned it earlier in this interview is around, remembering that China is a developing country. And that's not an understatement or just to use it whenever it's convenient. The medical system is one of those areas that China, as a country this big, has had serious issues with and difficulties with. And that's part of the reason of some of the lockdown measures as well, is recognizing those weaknesses, and that it would be, quite disastrous to sort of let COVID just rip especially in the beginning of the pandemic. And one of the key areas is looking at the intensive care unit capacity,
Mm-hmm.
especially for those with serious cases. And comparing the U.S. is important to kind of remind us at which developmental stage China still is. So at the beginning of the pandemic in 2019, China had 3.6 ICU beds per 100,000 residents. That's usually how it's calculated. So it's proportionally, right? In the US, it was 9 times more, at about 34 units. So China only had a ninth of the capacity that US had, with a much larger population. And since then, China has increased massively its supply of those beds, about 2.5 fold, to now it's around 10 beds per 10,000. That's a huge improvement. But of course, as you mentioned, building the hospital, actually it's 2 hospitals in 10 days. Um, you can build that in 10 days, but you can't train a doctor in 10 days.
Right.
So there's been an increased effort to also train doctors and nurses, and it's doubled. Nurses have doubled, and doctors have increased by a third. But that's a huge sort of in progress improvement that needs to be made, especially around doctors and medical workers going into the countryside, because in the rural areas, that's definitely where the medical health system is at its weakest. So right now it's a difficult moment. I think a lot of the different places have experienced this already. We didn't have this kind of spike in cases and in the last 3 years, since Wuhan, really. And I really feel for a lot of the doctors and nurses working on the front line now, working overtime, huge pressure, huge exhaustions. The hospitals are full. So we don't want to minimize that difficulty and contributions. There aren't the massive sort of lines of people burning bodies in the streets. There's none of that I've ever seen. But let's not. It's a good reminder that opening of the borders isn't the end. The country still needs to continue to do more and not let its guard down, as it's confronting this new and challenging moment of transitioning to kind of a new phase.
Yeah.
But the fight isn't over.
Yeah, and I mean, just to point out too, I mean, as you're talking about increasing training of doctors and nurses, I mean, in the US we really did see. And I'm not making these comparisons to say like, "Oh, the US totally sucks and China rules." It just really is striking the contrast because in the US there's actually a massive shortage. Like doctors retired early. Nurses have retired early. Like they're leaving the profession because of how difficult the last several years have been under the pressures of dealing with like just hospitals over capacity, COVID taking up all the resources, other things. It just, I mean, it was a horrible situation, and it
Mhm.
is really, really sad because healthcare is such an important industry. It's such an important part of any healthy society, and it did at moments in time throughout the pandemic in the U.S. It felt as though in certain parts it was like collapsing, and now there's fewer of those professionals than we had before who are actually like needed
Mhm.
to keep people healthy and alive. But I want to move on to the current phase, which you call phase 4, downgrading severity and easing controls. And that's been in place basically very not like recently, since November 2022 to the present. So since November, the Chinese government has been easing restrictions as a part of this current phase. So I'm curious if you can describe the changes here and more importantly, I think what's been the reaction in China, because we saw this excitement in Western media that some of the grievances expressed in certain protests that arose basically against restrictions would lead to like the overthrow of the Chinese government or something.
Yeah, I mean, it seems like every other week there's a reason why the people are going to overthrow the government, but it seems to be a lot of wishful thinking from their part. You just have to substitute like what is causing the overthrow, and then put the same headline, and it keeps seems to be like a broken record that repeats and repeats.
Right.
But I can tell you it's not happening. Um, but I will talk about sort of, this relaxation period. As I mentioned, that really began with these 20 measures on November 11th. That was this initial phase of easing. For example, one of the important things is max lockdowns were not no longer used. And also some of the initial relaxing of the border controls in terms of how much time one has to be in hotel quarantine, and a kind of transitional moment. And when the news, I think around the kind of series of coordinated and relatively small protests, hundreds to a few thousands at most in a few cities, which have become now known as the white paper protests because they were holding white pieces of paper with, I think, relatively unclear demands. That really caught the attention of the Western mainstream media, and I always say it's kind of suspicious when the New York Times choose to represent some protests on their front cover and then basically silence the rest of mass protests around the world. So we have to look at it with a very keen eye. Um, I think it's important to mention that came as a result of a very tragic fire that happened in Urumqi, which is a city in Xinjiang Autonomous Region, on November 24th, where 10 people were killed in that apartment fire. Initially, there was thoughts that this was linked to the zero COVID measures that were still in place, but since then, it has been shown that that wasn't the case. That building and that area was not under lockdown, and there were other factors involved with why that fire ended up leading to deaths, including that the area was very narrow in the streets, and the fire trucks couldn't get there in quick time. That being said, over the next couple of days, there were a few of these protests that took or caught the attention of the West. And then this started the story about how these protests were not only anti-government, wanted to bring the government down, but also they were a victory in pushing the government to end their zero COVID policy. Of course, that's just factually untrue because 2 weeks prior to those protests, the government had already started relaxing its measures. It was already in that process of it.
Right.
That being said, I just don't want to focus too much on the protests because they've already had enough of their time. I just want to say that they're not at all representative of Chinese public opinion, and that has been very diverse and very and also filled with their own frustrations. But overthrowing the government is not the general one that most people care about. That's not going to really resolve their frustration with their local official who's being kind of a jerk and not upholding the policies in the way that they think they should be.
Yeah.
Um, and I think we can maybe talk a little bit more about that, depending on what, in terms of some of the opinions that are huge for a country of 1.4 billion people. So, I mean, since then, now is this new second wave of opening policies. As I mentioned, those flights have started to come in now, and it's been an exciting moment, especially for some families that haven't seen each other in some time. And we'll have to continue seeing what the next phase will bring.
Yeah, and I'm curious if you could elaborate a bit on that because so at least so far, because this new phase isn't just to like open up, like no, okay, no more measures in place. Let's just get rid of the mask. Like this
Yeah,
is
good
U.S.
riddance.
style. Yeah, U.S.
Happy
style.
New
Open
Year.
up. There's no more masks, no more mitigation in place. Let's just pretend COVID doesn't exist, which is essentially what is the case in the West now, and honestly, in any places that have replicated the policies of the West. Like I'm in Lebanon, and honestly, being here doesn't feel much different than being in the States. Because it's just like I forgot. Honestly, I forgot COVID existed. But of course, people are still getting it. People are still getting sick with it. But it's as if it doesn't matter, right? So in China, obviously, there are still mitigation measures in place, and certain measures will remain in place. I assume for the time being. So can you talk about what measures are still in place, at least for now?
Yeah, I mean, I think on a daily life level, in terms of wearing masks, That's just hasn't actually been a problem even in the last 3 years. Like even when there were no outbreaks, and even during the period of the second and third phase where there were relatively few cases, people wore masks. And that's, I think, there's a kind of cultural consensus that wearing masks is a good thing to not only protect yourself, but to protect other people. And so that kind of rampant individualism that we see in the West is just not so apparent here. But so people still mask, even though it's not necessarily mandatory. People are wearing it. People wear it obviously in transportation and their public places, and that's normal. And then actually in the winter, it's great because it keeps the cold away,
Yeah, it
especially
does. It
for
actually does
who
feel
live in
nice
the
on your
north.
face. Yeah.
Someone had told me it's like a sweater for your face. I'm like,
It
that's a
is.
lovely way to put it. It is.
I totally
But
agree.
as you said, it's not like, Happy New Year, we don't care anymore. Yes, there are some measures that have been removed, like the mass testing I mentioned. Um, but there are other ways that this is being monitored by the government, in terms of sometimes, some cities have started using these extensive surveys to be able to understand more qualitatively how hospitals or certain regions are responding, their capacity, the availability of medicine, etc. There's still data being gathered, now less in this kind of daily way, in this mass testing way, but through monthly publication of cases, especially serious cases, those who've actually been hospitalized, those who have died in relation or related to complications, and then also implementing new protocols, of how to prepare for possible new variants, or new viruses, and how to monitor sort of unknown viruses and be on guard for inevitably future viruses that will spread. This is not the last, and this is not the first virus that the world has seen.
Right.
And they haven't, also, the government hasn't given up on the possible use of PCR testing again, or antigen testing, or um, uh, sort of monitoring, especially in case of emergent situations that might arise. So, and by no means is this something that has been kind of thrown in the towel or done and dusted.
Hmm.
At the same time, vaccination is still continuing. Provision of medicines, especially to the rural areas, has been amped up. Production of medicine has been amped up, and a whole variety of measures that accompany this change or relaxation from Class A to Class B of COVID.
And then, you had kind of mentioned a little bit about, there obviously are different opinions in China. And contrary to what we are told about China in the Western press, that it's this like monolithic state where, President Xi or the Communist Party make all the decisions and everybody has no choice but to follow. You're not allowed to dissent. But obviously, these policies over the last 3 years were created with science in mind. And surely there had to be some back and forth, some debate. Even now, there must be some debate on the best way to go forward. Can you lay out the various opinions across the country? And I know it sounds so silly and like basic, like, of course, there's different opinions. But since we're talking to an American audience who's been primed to believe that that doesn't exist in China, can you tell us a bit about that?
Yeah, no, I mean, I think it's important to remember, yes, Chinese people are human beings, in case you forgot. We have ideas, we have thoughts. No, we haven't been all brainwashed. Anyways, it seems funny because I think you have to laugh to not to cry, something like
Yeah,
that.
yeah.
But I think, I mean, it would be surprising to me that a country of 1.4 billion people could be just ironed with an iron fist alone, that there wasn't kind of a social consensus, or that has to be developed, and how many different views that 1.4 billion people hold. So remember that there's no singular voice. And I think even in this easing phase, we've seen lots of different voices. When the government back in November decided to start easing the measures, there were a lot of people who were quite nervous, who didn't want to see the relaxation. They liked zero COVID because they felt safe. I know people who self isolated at home for weeks after the loosening up because they were afraid to get the virus, they get
Right.
infected. There are lots of cases, this was shared a lot in social media, parents calling in sick for their children at school with like all kinds of, all kinds of like excuses, like, oh, my daughter has like an arm ache, or a tummy ache or a headache and can't come to school because they were afraid of easing measures. Then there were also other people who showed a lot of frustration when the easing was happening, mostly around the implementation. And that was a big issue because, any central government policy to be implemented at the local level takes, quite a bit of work and sometimes has a lot of frustration and confusion. So a
Mhm.
lot of people were upset with what they saw as local officials not respecting the loosening policies that the central government was putting forward. And then we've already talked about some of the protests, and the profile of the people are largely younger, sort of urban middle class people. Um, and some of them were calling to, this liberty to sort of open the borders to travel, not take PCR tests. And sometimes I like to remind people that only about 10% of the Chinese population actually have passports. So you can already see that kind of class and social profile of those who are demanding to, like, I don't know, go to their
Right.
beaches or, like, Miami or wherever that they want to go to. That's not representative of most people's sort of daily concerns.
Right.
And then also many people were very upset with the protesters, especially after as the easing continued, and seeing that that was an irresponsible demand. That, the sort of middle class youth sector wanted their personal liberties at the collective expense, especially of older people who are vulnerable. Some have even called for sort of the government to reinstate the zero COVID policy, that things were better. Even some who had said, no, 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 I was supporting the opening, and then now I regret it. So that's to say that this is going to be a process still. China is a place that has to build a kind of social consensus. It has many different voices, and I would just urge, especially your listeners, to not easily kind of fall for that blanketing, singular portrayal that the Western mainstream media likes to do of a country that is so diverse and so large.
There's one thing that's been controversial since the beginning of the pandemic, and that is, of course, because as we've been talking about throughout this entire conversation, the Western media, it's like China just can't do anything right. China lies. You can't believe anything they say. So since the beginning of this pandemic, you've had the Western media claiming that China's lying about its death toll. And, there's been claims throughout that, like, actually they're lying, like millions have actually died. They're just hiding it. Um, and then, of course, like I showed in the beginning, some outlets like the Washington Post are projecting 1 million deaths from easing restrictions. But I'm just curious. I mean, obviously, China's a massive country. We know at least there's been confirmed like thousands of deaths. But does this idea that like there's actually been like millions of deaths and it's been like being held secret or something, does this have any basis in reality whatsoever? What is the general understanding of how many deaths in China? I mean, regardless, obviously it hasn't been as many as in the West, but
Yeah, I mean, this is an important question. I mean, it's sometimes interesting. It's linked to your last one, right? Okay, now I have to say, yes, we are human beings and we have ideas and
right.
thoughts and different opinions. And now we'd be like, no, we don't always lie as well. I don't know.
Prove
Apart
your
from those
humanity. Prove your humanity. You have to constantly prove your
Exactly.
humanity. Jeez.
But if we have one voice, can we all be lying at the same time? Is
That's
that
a good
what's no?
point. I guess that's
Anyways,
how it works, right? That's how it works. It's monolithic lying.
yeah, exactly. Monolithic lying. I mean, especially in preparing this article, I was really trying to look into some of the prediction models that are out there. And one thing that's very clear is no matter how much the scientists have tried to kind of correctly model COVID-19, the results are hugely varied. And depending on sort of the length of the prediction period to which place you're actually analyzing, the numbers are really vast and different. So we can't apply to any singular model, whether of cases that have already happened or in terms of future predictions onto China. And even those countries that have experienced the Omicron variant, just studies of the Omicron variant have resulted in extremely different mortality rates depending on the countries. So scientists are still working on that. That being said, um, of course, downgrading the severity of the virus and the management of it, and going from class A to class B, like we talked about, is going to increase the number of infections, and that means related deaths. That is something that I think we cannot deny, and that's also just scientific. Um, and this is going to be the case, and has been the case, amongst the elderly and the most vulnerable population, or the still few, but still existing unvaccinated or lesser vaccinated people. So if we look at one thing, I think when we look at the elder population, one thing is interesting comparing it to the US is that, US, of course, there's still quite a few deaths per day. And when I wrote the article, I was looking at the sort of what's called the 7-day rolling death rate is around 400 people per day or so.
Mm.
And that gives you a certain rate. But one of the things that's key to note is that the U.S. actually has a much larger percentage of its population who are elders than China. China is,
Ah.
catching up, but the proportion of elders is much higher. So even if you use that current Omicron death rate and apply to China, you would already see something like a 30% reduction in likely deaths, because
Mhm.
there is just a lot less, relatively speaking, old elder people, even if they're the most vulnerable. So that's one thing why I don't think there's going to be the millions of deaths that are being reported. And I guess another thing is that we know how Western mainstream media, and of all people, having done this work for so long, and trying to challenge a lot of the kind of just outright lies. But one of the ways is to kind of selectively use stories and photographs and try to create this image of the chaotic situation, including outright fake news. And I'm not going to sit here and sort of defend each one or not. But I think it's important to remember that China is huge. When we have a population of 1.4 billion people, before the COVID, on average, on any average day, there's about 27,000 Chinese people who die for
Mhm.
a variety of reasons. It's just that big of a country, for natural causes, for other illnesses. And so when we look at some of the Omicron rates now, we could expect that kind of possible, few percentage of increase in the death rates, which for a country of this size can be significant. It might be in the tens of thousands. But there's no evidence at all, and nothing, after having done quite a bit of studying over the last few years, but in particular now for this article, that would say that there are the millions of deaths that are to be expected, looking at how the country is prepared, how the people have been protected, and also just even the science of what's out there.
That's a really good point. And I also think that, we've talked so much about what the Western media is getting wrong and trying to correct it. But I think, unfortunately, as a result of all of this China bashing, it's like it actually does a disservice to the world, because there's so much to learn about China's handling of the pandemic. I mean, the fact that regardless of whether the death rate that we know about is perfectly accurate or not, what's clear is that compared to the rest of the world, China saved so many lives. And they're continuing to do so. They're continuing to evolve. They figured out how to deal with this pandemic in a way other places did not. And because of that, there's a lot to learn from it. Maybe, I mean, there was, I'm sure, mistakes made along the way, but there was also a lot of effective, successful measures. So, can you talk a little bit about that? Like, what do you think the world can learn from China's handling of the pandemic?
Yeah, I think I'm glad we're talking about this. I think it just gets masked in all of the sort of political rhetoric and the
Mm-hmm.
sort of China bashing at all costs that does a disservice for humanity. One of the things is, we know in a world that is so globalized and so complex, that more viruses, and even perhaps more deadly viruses, will come. In fact, that's not a if, it's a matter of when. And so how ready is the world? We were talking about nearly 7 million people who have at least been confirmed. Let's not speculate about the people who we don't know if they died or not, but we know for a fact the recorded deaths are closing in on 7 million people in the world. And those 7 million people, what did they die for? Is our world more prepared? Are most governments and health systems more prepared to confront the viruses that will come? And I really do fear that most countries have come out not more prepared and not more ready to confront that. And certainly in terms of on an international stage, there's a lot of just politicizing of the virus that which means that unity was not able, in terms of achieving a kind of unified response. And so I do hope that in terms of from China's experiences, these are hard earned lessons. These are lessons that cost lives of people, in terms of how to act and cooperate based on science, not just rumors. I mean, thinking about vaccination, global vaccination schemes, especially thinking about the public good of vaccinations, knowing that the world is highly unequal and the production of vaccines and access to vaccines is highly equal, obviously due to long historical processes. And I think one thing that really stuck with me is, I remember back in the early days, the WHO head was talking about the need for international solidarity and not stigma. And I think this
Mm.
is one of the lessons that comes out of this, because as we enter this new year, and we'll be celebrating Chinese New Year, another new year in a couple of weeks, we're going to be in a new era fighting COVID and new viruses to come. And certainly that kind of preparedness, the scientific thinking, the ability to experiment, willingness to experiment, and the willingness to put economy sort of on hold or at least at bay while prioritizing people's lives are serious lessons, I think, that we should learn and other countries should learn from the Chinese experience.
And that does also point to a certain value system that you could connect to an economic model, right? So, and that's a segue for me to, how important of a factor is the economic system in the different strategies and outcomes in places like the US versus China? Because here we're talking about hyper capitalism in the US versus this socialist model in China.
Yeah, absolutely. I mean, I don't want to come off as sort of being an apologist for all things China is great and the best thing that's ever existed, on this earth. But I think there are
No,
some
we're no, that's
advantages.
that's what capitalists do.
Yeah, right. I forgot. Um, so, I mean, one of the things I think is the capacity to mobilize, different sectors of society, and that does come with its kind of, let's say, socialist structure that China is. People often ask me, "Oh, but isn't China already capitalist? Like there's Jack Ma's and there's Alibaba, isn't it? I mean, it has lots of billionaires." I think one of the thing is, and COVID was a good reminder, the response to COVID, that China is a socialist country where there are capitalist elements in capitalism, not capitalism as a system.
Right.
And so when a moment like a crisis like this happens, the government, and which is driven by the CPC, can act, can respond, can immediately, when Wuhan closes or close the borders, be able to organize and dispatch 40,000 medical workers from all provinces and regions from across the country. It can organize the kind of production facilities to be able to convert some of their productions towards medical supplies that are essential, and then also direct the universities to be able to start vaccine research and testing and a variety of things. So all this sort of tools and that are disposal at the state is something that we really saw China be able to mobilize. So there's the human resources, but also resources of the state. We use the example, and it's quite a famous example now, of being able to build a hospital or two hospitals in 10 days. That says a lot of its capacity to be able to not only say, okay, this area of land, because of course land is still owned by the state, not by private individuals. You buy actually the right to use the land, but you don't actually buy the land itself. That's something fundamental in a socialist country. So to be able to, the government, okay, here is the land that we could use. Here's the expertise that we can mobilize to be able to build that. Here are the resources to be able to build that, and also how to get the capital to be able to build it, and et cetera, et cetera. So it's not just sort of a miracle that China is able to do some of these things. That's linked deeply to its socialist system and socialist organization of society. And I think, and in many ways, the country has come out more prepared in the future to be able to respond. For example, a lot of the neighborhood associations, which is the base level of organization of the country, was really activated in this moment. In some areas, they hadn't been very active, but this crisis also kind of shook up the country to get everyone sort of participate in some way, shape, or form.
And I just want to clarify when I said that about capitalists, I didn't mean that they defend China. I meant that capitalists have zero nuance about how much capitalism sucks. Whereas I do feel like when it comes to at least the socialists I know, there is an ability to like reflect on successes and failures that I just don't see on the other side. But anyways, I the last thing I want to ask you about here is a bit of a pivot, but I think it's absolutely connected to everything we've been discussing for the last hour. And that is that, so much has happened since the pandemic began. It's been 3 years. That has actually felt like 20 years somehow. Now the news is dominated by the war in Ukraine, by NATO expansion, the US escalating tensions with China over Taiwan. And, this all comes after the behavior of the US over COVID, which was, to blame China. Plus, it's very aggressive behavior, as I mentioned, over Taiwan, trying to also at the same time turn NATO into this anti China alliance, even though it's called the North Atlantic Treaty Organization. And as far as I understand, China's not in the North Atlantic, but that doesn't seem to really matter. And that's, of course, after the violence back in 2019 that the US encouraged in Hong Kong. So, my question for you is how do you think, or how have you seen Chinese attitudes about the US change in recent years, given all that's transpired?
Yeah, absolutely. I mean, the COVID moment brought out or highlighted some of the trends that were already happening. Of course, the Trump era trade war, even Obama's sort of pivot to Asia. We've seen that turn towards looking at China as a strategic enemy of the US for some time. But COVID really kind of hit it home. And I think for the average Chinese person, the last 3 years have been quite enlightening, and some might even say kind of awakening in terms of what is the US in its nature, which, of course, China being a country that is in development and has tried to, make friends with most countries and be a trading partner, the largest trading partner of most countries of this world now, including the US. This was a moment of sort of a idealization of the US and seeing sort of, taking those rose tinted glasses off and seeing, wow, okay, this is what US will do. Um, and I mean, when I mentioned this sort of solidarity, not stigma, it is quite shocking, I think, for a lot of people to see how um, that China was condemned in every single phase of its fight against COVID, even when I think most countries had already thrown in the towel and just given up, and just basically said that the lives don't matter in this, and we have to live with COVID. China was still trying to find different ways to find this balance and prepare the best they can for a moment that the country could sort of relax its measures. But there was really only attacks and furthermore increased sanctions led by the U.S. But also, with its allies, increased attacks on a variety of areas, including in terms of in the media. Of course, we know the U.S. has a huge set of tools, not just a hot war, cold war set of tools, but also hybrid warfare, where the media and misinformation is a big part of it. So I think in this period, it's been kind of we're in a phase of cautious optimism in terms of a new kind of relaxation. It's been exhausting to deal with COVID, but also recognizing that the US has really shifted its focus onto China, and it's less of a friend than I think most Chinese people thought it was.
Well, Tings, I want to thank you so much for putting together this really incredible piece, which again, I will link to in the description. And I want to thank you for all of your wonderful work and for being a repeat guest on Dispatches. And for spending an hour talking to me about this. I hope we can have you back on soon, hopefully to discuss more positive things. But thank you so much.
Absolutely. Thanks, Rania. It's always a pleasure to talk to you.
Thanks for watching, everyone. If you want to see more progressive anti imperialist content like this, make sure you hit the subscribe button so you can stay up to date with the latest breakthrough news content. And if you want to support our work and get access to exclusive content, head over to patreon.com/breakthrough news.